have the greatest privilege this evening, and that is to welcome you to another episode of Mantled for More. And because we're mantled, we have our team here ready to take you into our discussion space. Kaydian, hi. Let's welcome our ladies.
Hi, Sherye. Welcome, ladies.
Welcome, guys.
Yes, tonight is going to be an exciting night.
I believe.
Yes, yes. Matter of fact, today's conversation comes from a question that Christians have quietly asked.
Mm-hmm.
Can Christians experience depression and anxiety?
What? What?
But before we answer that question, let me ask a deeper question.
Yes.
Have you ever smiled at church, at school, at work, even at your home, while silently falling apart inside? Have you ever asked the question, how can I be going through this? Am I trusting God enough? Today, we are going to have an honest conversation about something that many Christians have felt, but are not brave enough to discuss.
Well.
So our topic this evening is faith and mental health. Can Christians become depressed and anxious?
You said a very important word that I want to just lay. You mentioned the word honest conversation. And because we're going to be honest today, I know there's a special guest to take us through this session. Who is she?
Oh, yes. So we have a special guest. And her name is Mrs. Beverley Chung-Brown, affectionately called Bev. So you'll be hearing me calling her Bev. Yes. And it's a delight for me to introduce her. Now, Beverley is an experienced nurse leader with her master's in nursing from the Athabasca University, where she specialized in teaching and leadership. She has over 32 years of clinical and educational experience, and she currently serves as the clinical practice leader for the mental health and addiction programs at the Lakeridge Health Hospital in Oshawa. She also serves as the health ministry's leader at the Apple Creek Seventh-day Adventist Church. All right. She is married, yes, so she's not available. She's married to one husband, Dwight Brown, and she has one son, Nathan. Anyway, her Christian faith has been where she gets her resilience, and her favorite text is from Philippians 4:13, which is, I can do all things through Christ who strengthens me. So, welcome, Beverley, to our discussion space, and we're looking forward to the discussion ahead.
Welcome, Bev. Excited for this conversation. Yes.
All right. So we're talking about this depression and anxiety.
Right. So basically, Bev, I know that you're expert in this. So our first question is, what is depression? What is anxiety? How can someone identify with these feelings?
Okay. That's a great question. So I'm going to first of all, I just want to kind of put out a disclaimer, is that I'm not a psychiatrist. I don't diagnose, and I don't prescribe. So my response will be from a mental health nurse perspective. So I just wanted to, all right. So what is depression? So depression, in just a simple word, depression, anybody can be depressed, right? So I want to make it clear that there's a difference between having depression and having a major depressive disorder, which is, so we need to make that clear from the outset, because we all can get depressed, because all depression if you were to define it as the word depression without the major depressive disorder, it's sadness, low mood.
Okay.
Can say that we've been sad at some point in our life or feel low, it doesn't mean that we have the major depressive disorder. So I feel like for the conversation today, if we want to kind of really look at the disorder, which is the major depressive disorder, which is a depressive illness, then I can tell you that what major depressive disorder is a condition that lasts for at least 2 weeks, which sounds like, so you get like persistent sadness, loss of interest, appetite changes, low energy, and sometimes thoughts of death. Okay. So that major depressive disorder, that diagnosis comes from what we call the DSM-5, which is, if you like, the psychiatrist's Bible. So they use a diagnostic manual to actually diagnose the major depressive disorder. So anxiety disorders, on the other hand, it's a number of disorders, but I think for tonight's presentation, we only have time to maybe look at generalized anxiety disorders, and basically what is excessive worrying most days for at least 6 months, which often affects daily functioning of someone. So if I have anxiety, it's basically that I'm anxious about everything. So that generalized anxiety disorder is what happens is the individual, when they have that disorder, that they're worried about everything and anything. Doesn't matter what it is. And there's no real reason for them to be worried.
Yes.
Basically, it's a state of mind that they're always worried that something is going to go wrong. So what happens is it prevents them from daily functioning. So they may find that they can't get out of bed. And so anxiety and depression kind of coexist. So when you have a major depressive disorder, there can be some anxiety that's coupled in with a depressive disorder as well. And so both together, it actually debilitates the person from getting out of bed. They don't want to do anything. They don't have energy. They're fatigued. They lost interest in everything. And then that sort of spills over into relationships, right? So I'm feeling really depressed and I have no energy. I have no appetite. I've lost interest. I don't want to go to work. I'm not motivated. And I say, for example, if I'm using me as an example, as a mother with a husband and a child, and I'm not able to function at the level that I'm supposed to because I'm so depressed that I don't have the energy to do anything. Wow. So that's typically it in a nutshell without going into too many. I know we're going to discuss a little bit more later on, so I'll kind of hold back some of my
yes.
later.
Thank you so much for that.
Yes. So what we're understanding is that both depression and anxiety is debilitating. It really prevents you from being your best self. And that's why we're having this discussion this evening, because we're trying to transform your lives, our lives, in living in that more that God has in store for us. All right.
I do have a question. I listened to you very carefully, and I noticed that you said major depressive disorder could last for about 2 weeks. So if I am understanding clearly, someone could experience that for 2 weeks, but how do they know that they have it? How would they know? So that's part one. Part two would be, could a person have this major depressive disorder and still function as if everything is okay? Is that possible?
Yes. So the first part of the question, and maybe I wasn't clear. So when I was explaining about the 2 weeks, what I was trying to explain is that the psychiatrist will diagnose the patient who has these symptoms over a period of 2 weeks. But the major depressive disorder, nobody gets over a major depressive disorder in 2 weeks.
Oh, okay.
Let me be clear. So maybe I wasn't clear enough. Right. So what I was saying was the symptoms will last up to 2 weeks for them to diagnose that, hey, wait, this person hasn't actually been able to do much over that 2 weeks, and they have that persistent sadness and loss. The second part of your question, you ask, can somebody still function? Yes, they can. So the thing with major depressive disorder, and I know you guys may go into it later, is that with treatment, someone can still function optimally. Right. So I don't know if you guys want me to talk about the treatment now or later, but I could just basically, just to answer your question, Simone, is that with antidepressants play a huge part in treating someone with major depressive disorder. They also can use psychotherapy or counseling. We have something called cognitive behavioral therapy that we use to treat depression. And basically what that is, it helps the individual start to look at how do I cope with those negative thoughts that I have that's going to impact my behavior and impact the feelings of low self-esteem, low self-worth, and all the negative emotions that come with depression. So someone can still function, but what's important for us to note is that initially they're not able to function at the level that they would typically function at. But as treatment is occurring and they're progressing and they're responding to treatment, they're now able to gradually start to go back and return to their daily activities and live an optimal life.
Right.
Right,
So
but-
permit me to ask a follow-up question. I know you said that we all become depressed, and it may not be the major depressive disorder, but what about when somebody is extremely sad and we would say depressed and discouraged? They're going through their regular life. They're not seeking treatment. They're still functioning as the best as they can. They're a mother. They have to take care of their children, so they get up and do it. How do we factor that in? Is that a different type of depression? Because I can look at individuals and perhaps myself at times where I would say that I'm perhaps experiencing a major depression, but I don't necessarily go and get help, although I know help is important. So I'm not saying that it's not, but I'm just saying for a lot of people, they don't necessarily get the help. They push through, they pray through it, and they tough it out, as we would say.
Absolutely. Yes. That's a great point. What I would say to that is when you look at depression, no two people respond the same when they have a depressive illness. Some of us have what we call, there's an R word called resilience. Some people are able, like you said, to tough it out. And for some reason, you know, I don't know if you guys are going to bring this in, but I remember doing a talk on Black women in particular, how we're supposed to be strong and we're supposed to tough it out even when we're feeling depressed, because everyone is looking to us to be the mother, to be the home carer, to still be that wife and do all the things that we're supposed to do as responsibility. And so even when we're feeling down and low and depressed, we still feel that we need to just push forward and we're crying through our pain. And I think that's why this conversation is so important, that we don't have to always be the strong person, that when we're going through difficult times, we have to take care of ourselves and we have to say, hey, yes, I'm feeling depressed and it's okay for me to be depressed, because you know what? It's a natural emotion. It's a natural emotion that God has given us, that when we're going through distressing moments, it's okay to say, I need the help. And you hit the nail on the head. You say some people may not even feel that they need the help because they're told that you need to tough it out as a woman. Because you're supposed to be strong and you're supposed to be strong for everyone else.
So, Bev, I heard that, especially for depression, there are like two types in terms of their cause, the reactive and the endogenous. Can you speak more on that?
Sure. So with depression, we have two types, like you said, Kaydian. So we have what we call endogenous depression, which is basically caused by biological factors or genetic factors. And typically what happens is it's usually the brain chemistry that's having changes. And typically what happens is our serotonin, our dopamine, and our norepinephrine neurotransmitters in the brain, they're not sort of functioning the way they should. And so all those three together will allow us to feel like we don't have the energy, we don't feel happy, it's impacting our mood, it's impacting our sleep. We don't have those sort of reward pleasure system is not, if you like, it's not working to fullest capacity. And so that's why we have the loss of interest. We don't feel pleasure. There's something called anhedonia, where we just don't feel pleasure, even though, you know, we're supposed to, but when you're depressed, you don't feel that, right? Because the brain is functioning at the level what it's supposed to be, where there are pleasure centers are working optimally. So the endogenous is usually internal factors, whereas the exogenous, which is your reactive depression, is usually caused by external factors, like external stressors, usually like a major loss, a divorce. I lost a partner. I lost a child. Some tragic circumstances that will happen in your life. Chronic stress. It could be even something like a trauma. Trauma history can cause depression as well. So those are the two different types. And I don't know if, there's this thing where people will say, you're married, you have enough money, you have a nice house, you have a nice car, you have everything going for you. Why are you depressed? And people can't see why people are depressed when they seem to have everything materially, right? And they're like, why are you depressed? Because, again, it's an internal thing that's going on. Typically, it's a biochemical imbalance that's happening in the brain, which is why we use antidepressants to treat those types of depression. Yeah.
Do you think that personal response is different when it is exogenous or reactive or endogenous type of depression? Because as Simone alluded to, there are some persons that can push through in spite of what they're going through, while others just kind of succumb to it.
Yes.
Okay, so there's a 4-letter word called hope, HOPE, right? What I'm finding, and when I've been nursing all these years, one of the things that I'm noticing is that if someone doesn't have hope, because we know with depression, people are hopeless typically, right? So if there's no hope, if that person doesn't have no hope and they can't see a light at the end of the tunnel, it's very hard for them to now start to say, you know what, I'm going to get up, I'm going to get out of bed, I'm going to do what I need to do to get moving. And so, on the other hand, you have the person with hope who decides that, you know what, despite how I'm feeling, I'm going to push through it. And there's something called, I'm going to use that word again, guys, resilience. No two people is going to respond to situation at the same way, right? And so I know that we're talking about faith, and I'm going to say this because I feel like this is what the program's about, is that when we are Christians, when we are serving Christ, we have that extra, I want to say that spiritual extra mode, reserve that we use to get through our pain, because the way God created us to feel pain, God created us to feel joy, right? Sadness. However, for the Christian, when we have a depressive disorder, we're not just depending on the antidepressants or the psychotherapy. We're praying. We have the word of God. We're reaching out. We're looking at Psalms. I think about Psalms. Psalms, for every emotion that we feel, every negative emotion, there's a psalm that we can read.
Yes.
So we have God's word. We have prayer. We have our spiritual brothers and sisters. We have our pastors. We have a network of spiritual people around us that can build us up. And I know when I go to church on a Sabbath and they're doing praise and worship, if I go in and I'm feeling really low, I just want to go into church and the praise and worship. When I leave church, my mood is gone from low to high. So all these things that we have around us that can help support us, if we have the support system, it's huge. People go through depression and they're isolated and they have no significant other, they have no family or no loved ones. It's very, very hard. Yes. So having that village, that family support, that social support is huge for somebody going through a depression.
Yes. Yes. All right. So we have heard it. We have heard what depression is, what anxiety is, as it relates to how it makes us feel, how it manifests itself. So we're going to take a break. All right. So welcome back. I'm sure you are very intrigued at this moment and very into the discussion and looking forward to hear more. So you've heard what this depression is, what anxiety is. So we're going to kind of delve into the signs and the symptoms, or what does it feel like? What does it look like? How can we identify these things?
When we look at someone with depression, how can we identify? So first of all, we're also going to look at a bunch of different things. So we're looking at behavior, we're looking at attitudes, and we're looking at what the person is communicating with us. So say, for example, if I see a friend that I hadn't seen, I don't know, 5 years, 4 years. And for whatever reason, maybe they're going through a depressive illness. And because I know the person's baseline, I know, maybe they're usually a cheery, happy person, happy-go-lucky. They had a full-time job, and they were functioning really well. And for whatever reason, that's not happening. And so what I'm trying to say is, one of the things that you would look for is affect. When we're assessing, we're looking for affect. If somebody have a very sad affect all the time, they're not smiling, even when, if something joyful is happening, they're not smiling. So the affect, things like they're not sleeping. They're telling you that, hey, Bev, I can't sleep at night, or maybe sleeping too much. I don't have an appetite. I don't feel like I want to eat because every time I eat, it tastes funny, or I just don't enjoy eating. Things like I just feel really tired all the time. My heart's racing. Maybe I have high blood pressure. I'm finding that I'm not able to focus. I'm trying to read. I can't even focus, not even for 10 minutes. Things like they have very negative thought patterns, right? Feelings of low self-esteem, feeling of low self-worth. Feeling guilty, lots of negative thought patterns, and lots of ruminating where they're preoccupied with negative thought patterns about themselves or even the world, right? They have no hope. They feel hopeless, and it's persistent and loss of interest and things like it also impacts relationship for somebody who's depressed. So if you have a partner who's depressed, you're going to notice that they may lose interest in intimacy. They lose interest in looking after the children. They're not showering. They're not brushing their teeth. All the basic things that you would typically do when you're not depressed. You find that this person is not looking after their hygiene, personal hygiene, and things like that. And also, ultimately, they're not able to go to work because they're not able to focus on their work environment. So they're calling in sick all the time, absenteeism, bunch of different things that impacts on and on and on. There's just so many things. So really looking at their functioning, that they're not able to function optimally.
Wow.
And then for anxiety, the heart racing, feeling like they're having panic attacks, that can happen. They're feeling like they have a heart attack. They can't breathe properly. And they're just constantly worrying and constantly just afraid. Well, mostly fearful because you have the flight and fight response that's kicking in all the time for somebody who's overly anxious all the time.
Yes, working in Emerge for some time, I've had patients that come in, final diagnosis is anxiety, panic disorders, but they come in with cardiac symptoms, the chest pain, the palpitations, shortness of breath, and all of that. So it can present as physical symptoms, even though it is a psychological one. Right?
Exactly. Yeah.
Okay. Bev, you did mention something about affect. Could you just explain what that is? Is that how they look, their facial expression?
Yes. So we have, so one of the things, just thank you for your question. So affect is looking at how the person faces. So basically what you are seeing. So that would be, as a nurse or as an individual, would be your objective assessment. Because somebody's affect can be really sad, and then they're telling you that they're happy inside. So when we're actually assessing the person with depression, we're assessing based on what we're seeing, so their facial expression, and we also assessing what they're telling us. Because sometimes patients will say, I'm really happy, but then when you look on their face, they have a sad face. So it's what you're observing. Yeah.
May I ask another question?
Sure.
What about the person who will put on a face? So they look like, how do you determine that they're not really happy?
That's a tough one. So you're right. There are people who walk around with masks, for want of a better word, where you're not able to tell. So let's just put it this way. So when you're assessing a person for depression, you're not just looking at one thing, right? You're not just looking at affect. You have to look at the full picture. So you have to look at what they're telling you. You also have to look at their behavior. What are they doing? Are they going to work? How is their relationship? What are they telling you? Because somebody can look happy, but then they're saying something else that's different. So looking at if this person was a happy-go-lucky person, were they participating fully in church, and now all of a sudden you realizing they're not doing that, or they kind of withdrawn, isolated, they're not going out with friends. When you say, hey, let's go out, they're like, no, I don't feel like it. So all those other things. So you're not just looking at the after, you're looking at the whole picture. What are they actually, how are they behaving? How are they responding when you get together socially, right? So they can put up a mask for so long.
Right.
It won't last. It won't last. So what happens ultimately, they break, and the true picture comes out.
Yes.
That's my experience anyway.
Right, so you could actually have someone.
Oh, yes.
You could actually have someone. You could say, "How are you?" and they could say, "I'm fine." But if you listen carefully, you hear that they're not fine.
Exactly.
Right.
And how often do we do that when we are at church? And I have times when I feel really sad, and I go to church and people are like, how are you doing? And I just say I'm fine, because you don't want him to ask you another question.
Right.
If I said, well, I've had a really bad, rough week.
Yes.
They'll be like, oh, well, Bev, tell me about it. You don't want to kind of stay, maybe. You want to keep it private.
Cry.
That too, right? You start to get teary-eyed and emotional.
Yeah.
So you keep it inside. And a lot of people do
And
that.
sometimes people don't really care. They ask, but they really don't want to hear
Yes,
the
it's
answer.
just a cliche. Yes.
Exactly. And people know if we're genuine or authentic or not. If we're just trying to pry, or do we really want to know how they're doing?
Right. Yes.
Sometimes they'll ask, sometimes when the question is asked, you answer, and the way how you answer, you don't need them to ask you another question. So that answer that you give,
So that's a
you just
is so
putting them
true.
off right away. So
Yes.
that's another sign of depression. The way how you answer, the person will just don't even bother to ask another question. Right. So who is at risk though, Bev?
That's another great question. So the thing can I just say we're all at risk? Okay.
I love that.
Let me just put
I love that.
None of us are immune to getting a major depressive disorder. We need to understand that. The beauty is that even though we know that, it doesn't mean we're all going to get depression. Okay, let me just say that. So who's at risk? People who've had a history of trauma. Some people have seen some horrible things in their lives, right? And they start to relive it when they start to remember, and that can cause depression. We look at if you have a strong family history of depression, you're more likely, we'll call it genetic disposition. Okay. Things like if we talk about the people who've had a tragic loss, that can bring on depression.
Yeah.
One of the things that we're finding in research now, or it's not even research, this is actually happening, where people with chronic diseases are also at risk from becoming depressed.
Wow.
Think about chronic pain.
Yes.
You're living with chronic pain, right? Cardiac, people with heart disease can also, there's a research that says that people who've had even a bypass, cardiac bypass, they're at risk from getting depression. And obviously this is for another show, but so these are some of the people who are at risk. Yeah.
I have a question.
Yeah, go ahead.
Can the environment push someone into depression?
Absolutely. So when we talk about environment,
climate. When I say environment, I'm talking like climate change.
Yes.
Yes.
Okay.
Cold and dark.
Yes. So they have something called SAD, seasonal affective disorder, right? So, but that's a different type of depression where people become depressed when it gets really dark. Like in Canada, it gets dark pretty early, right? In the winter.
Yes.
And during the winter, depression.
Yes. So some people suffer with what we call SADs. So yes, it can impact them. But they usually are predisposed before, right? So it's not just, you know what I'm saying? They have other mental health issues going on as well. And so we look at other disorders like bipolar affective disorders, where 1 minute they're really happy and then they're sad. And so there's a whole, it's a whole host. And we can't describe everything here, but there's more types of depressive disorders that could be addressed for sure. Yeah. That's one of them. Yeah.
Yeah, and just to comment on two things. Well, I'll comment on the latter. Sometimes too, depression can also manifest, have with it suicidal ideations as well, meaning that the persons have this constant thoughts of death.
Yeah.
I've heard of situations where, as Simone had asked, people can mask their depression. The person, what the family members noted was the person was giving away their things. They were very generous. And then shortly thereafter, the person took their lives. You know, it was when the family looked back in hindsight, they said they saw, but at the time they weren't able to detect it. So it's so important. It's a very important topic because, as I said, it's very serious for the person who it's affecting, and yet it can be so concealed that even the close members are not even aware of it.
I have a follow-up question, Kaydian, before you move on. Based on what you just said, right?
Yes.
Masking the depression push you into a deeper depression.
Yes.
So yes, you're depressed, but you smile and you pretend as if everything is okay. Can that push you at deeper risk?
It does. And I find that because when you're in depression, your thought is really negative. And that is why you're in that place. And the more you focus on the negative, it's the deeper you're going. And that is why scripture says, think on these things. If there be any virtue, think on these things. Right? The positive, because as Bev spoke about the neurotransmitters, the dopamine, the serotonin, the norepinephrine, those neurotransmitters can be easily manipulated based on our thought process. If we're constantly on the road of negative, our brain signals are going to change and be routed towards just negative feelings. And that is why it is so important for us to be positive in our thinking. And that is where Bev is talking about how important hope is important in terms of helping us to navigate through these challenges.
I know Georgette has a question, but for our viewers out there, I know that this topic is very sobering. I know that it is thought-provoking, and someone out there might be experiencing this feeling. Please find the necessary help. It is very important. And please talk to persons. Bev, as you mentioned earlier in one of your discussion there, I remember going to a seminar, a women's ministry seminar, and the counselor, who at that time was a social worker, she says that when she deals with Christian, it makes her life easier because they have someone else, the higher being, that they can relate to. So her work is easier than having someone who does not know God. Right? And when she said that, I take comfort in it to know that I have a God that I can always call on. It doesn't matter what I'm going through. And Kaydian, I know Georgette might have a question also for Bev.
Okay, so the question I have, there are two. One is, do children get depressed? And, what are the signs we need to look out for as parents?
Yes.
That's one.
Yes. Children does it.
Yeah.
You want me to answer that? All right.
Go ahead, Bev.
The signs you're looking for, they're not that much different from adults. So like for children, children isn't my specialty, but I do know some things. For children, you find that they start to become isolated. They don't want to play with their friends. They don't want to go out and play with friends. It could be that they're having issues sleeping at night, or they don't want to get out of bed. Maybe they just feel so tired and fatigued, lethargic. Having said that, if a child has those symptoms, we have to rule out the physical. We have to make sure it's something medical as opposed to mental, right? That's important. But usually when they get depressed, they isolate, they start to lose interest in playing their games, their hobbies. They don't want to go to school. Maybe they don't want to do their schoolwork. Just don't have interest in the things that they typically enjoy. If you know that little Johnny likes to play on his video game and all of a sudden he doesn't want to do it.
Nothing,
yes, but how can you identify, for example, if you have a child like mine who likes to lock up in a room all the time, and how you able to identify,
So
whether she's just being a typical teenager or,
I mean, here's the other thing you can do, Jordan. I mean, you can have a conversation with your child as well. If you're feeling that she's locking in her room and she's losing interest and she's not doing anything, or you think she's okay, but you're not so sure, having a conversation with your child to say, hey, I noticed that, you're not doing this anymore. I noticed that you're not going here anymore. Do you want to tell mom what's going on? Help me understand what's going on with you. Because I feel sometimes we can't just tell by looking, but we have to have that communication with the child to say, I'm noticing a change here and I just want to, mommy just a little bit concerned, just want to know what's going on, and open that door for conversation. But you have to look at the whole picture. So it's not just that they're locking in their room, but what else are they not doing, right? Are they failing in school? Are they maybe even getting irritable?
Yes.
One thing I didn't say, guys, is that males, when males are depressed, they behave differently from females.
Okay.
Basically, the research show that when men are depressed, they're not crying typically. They're more irritable, they're more angry. That's how they typically show. And so it's important to find out what's going on with that anger, that irritability. With women, we're more likely to be crying, fearful, emotional, and all the other things that, as a female, we're allowed to cry. But men have been socialized. You shouldn't cry.
Yes,
you
it must be tough.
Yes, tough it out.
You know what I mean? So it's important to also just put that into perspective as well. You may not know that your husband or your partner who is male is depressed because they're not coming out and say, I feel depressed.
And sometimes they throw tantrums because like my son, what he does, he will punch the pillow. I know when something is wrong with him because sometimes he will just be in the room punching the pillow. It's like if he gets something in front of him, he just want to beat it. Or stamping on the feet. And when you speak to him, the tears are just running like, something is wrong. So we need to sit and have that conversation.
Yes.
So important.
All right. I do have a follow-up question based on what Treacha said and what Georgette asked. So we've talked to the child or the adolescent, and we figure that it's probably more than typical, What should we do then? Are we going to be going to find a mental health professional to help us guide through? When do we know it's time to seek professional help?
Yeah. I think it's going to vary from child to child. And I feel like if you have a child that you're concerned about in any shape or form, your first port of call would be your family physician. You have to take and have a conversation because, like I said, we don't want to jump to psychological before we find out, is it a physical problem that's going on? Is it that they have low iron? Something else could be going on. But we know that with depression, sometimes we have gastrointestinal disturbances where somebody's, may have diarrhea or they have really stomach cramps. Those things are also indicative of depression as well, because the body
tumors.
Exactly. So your family doctor would be your first port of call. And then, you do a blood workup, make sure everything's okay physically. And then if it's not that, then the doctor will advise that, well, maybe you need to see a child psychologist just for them to do an assessment, like a thorough assessment to see what's going on.
I know we're leading up to our break, right? But I want to go back to something that you said. The medication, the chemicals in the brain. Is it that the medication works to help you to feel happy? Or is it that your thoughts, the medication help to change your thinking, change your thoughts? I want to know exactly how does that one really works?
So an example, serotonin is one of the neurotransmitters that's usually low, that regulates our mood, sleep, and appetite. So we have a particular antidepressant that we call serotonin uptake, if I'm saying that right. So basically the medication, thank you. The medication is manufactured with serotonin in mind so that it helps to build back that serotonin in the brain. So it actually works on those neurotransmitters. And when it works on the neurotransmitters per se, or or would make us happy, then that's how it works on the brain. And then you start to feel better. And usually with antidepressants, it can take up to 6 weeks to be effective. And they don't always work
So it
for
does
everyone.
take time.
Sometimes,
Right.
yeah, they have to try 2 and 3 before they find the one that really works for the person.
Right.
So it's
We
not
have to take a break right
Yes.
here because what we're dealing with right now, it's not even just about adult. We're talking about children. When we're talking about children now, this is where we have to lean in to this conversation. So let's take this break. And then when we come back, we're going to ask Bev to dig a little deeper into the whole idea of mental health.
Yes.
Hey, lady leader.
Yes, you.
Nope, don't look around.
I'm talking to you.
Did you know we're kin?
Yep, we're related.
We're sisters.
Cut from the same cloth.
The same heavenly cloth
Called to be leaders.
And mentors.
Creating spaces.
of kinship.
Kindness.
And connection.
Yeah, that works.
And hopefully meeting some kindred spirits along the way.
That was smooth.
I know, right?
Want to know how?
Sunday, October 25th, 2026.
The Kin Convention.
Hashtag King Khan.
She loves saying that.
I really love saying that.
At the Really Living Center in Mount Hope, Ontario.
Where female ministry leaders
All across Ontario.
Come together.
to be encouraged.
Equipped.
And reminded that
You
belong here.
And because scripture says, let us consider how we may spur one another towards love and good deeds.
We are bringing you inspiring keynote speakers.
Like her. Equipping and engaging workshops.
And an interactive, full immersive, kinesthetic experience.
Ooh, I like that.
Oh, you definitely will.
And don't forget to bring
Someone who you're mentoring.
A future leader with a heart for ministry.
Spaces are limited.
but we want you there.
So register today.
See you at King Khan.
You really do love saying that.
I really do love saying that. And what are you waiting for? You will too. Now click the link and we'll see you soon.
Bye. See you. Viewers, I hope you're still with us because we're having a real wholesome and needful discussion right here. So far, we have looked at depression, anxiety, what it is. We've looked at how we can identify it, not only in ourselves, but also in others. We've looked at who is at risk, and we've learned that everybody is at
That's the hard
risk.
part.
So now we're going to move into the final part of this discussion as we come to a close.
And I know Georgette must have a question that would resonate with you, our viewers. Georgette.
Right. I'm glad you said, Kaydian, that everyone is at risk, because I believe that there are Christians out there who feel depressed from time to time, and they are told that they shouldn't be depressed. They are being told that God has been good to them, that they are Christians, that they should trust the Lord, that they should have hope. And so they feel bad about even
Accepting.
feeling
yeah.
sad. You know, they don't want to face it because they are told that they are not a good Christian, but because they are feeling sad. How would you address that, Bev?
And before she addresses it, add this to Georgette. Sometimes the people will add, and you have everything. You have a nice car, you have a business, you have your family. You shouldn't be depressed.
Yeah.
Right.
So I think there is a myth, like you guys said, that if we're Christians, we can't be depressed. That is really. So I'm just going to put it into context. So we're saying, okay, if we're Christian, we shouldn't be depressed. Okay, so if I'm a Christian, I shouldn't have cancer, I shouldn't have diabetes, I shouldn't have high blood pressure, and all the diseases that we know sin brought to this earth. Okay? So just wanted to put that out there. what I would say is it's not a sign of weak faith because I am feeling depressed or sad or low, right? From a Christian perspective, we live in a fallen world. Yes, we live in a fallen world, which means we're going to face physical and emotional suffering, right? So faith is not the absence of struggle. It is trusting God through the struggle. And that's what makes a difference, okay? And we know that emotional suffering, it is not faithlessness. It's part of our human experience. And I think we have to remember that even though we're Christians, you know, you're saying to the person, we're human beings still. It doesn't mean I have less faith in God because I'm going through a depressive illness. What it's telling me that I need to now depend more on God because you know what? The struggle is real. We are fighting against not flesh and blood. It's spiritual wickedness in high places. And we know that the devil, enemy, will bring depression and sadness to us from time to time. What's important is that we're leaning on God through prayer, through fasting. And I know, guys, when we're going through depression, we don't want to do any of that stuff. There is no way we want to do any of that stuff. And this is where now we as brethren and sisters, we're leaning into each other. If I see my sister and my brother suffering, this is where I'm going to be there for them and help them through their struggles to kind of lift them out of that dark depression and say, hey, let's do this together. Because no man is an island, right? And we need each other for support. And it's really important for us to normalize when people say, I'm going through a depression. It is not abnormal because we have emotions. That's how God created us. And it doesn't mean that we can't get depressed. So that is such a myth. In so many ways.
I think that's the reason why the Bible says two is better than one. When one falls down, the other is able to pick them up. You know, we're all going to face things that cause us to fall on our faces. But it's that community spirit of love and fellowship that will help us to get out of it.
Amen. God is so amazing. You know, even as I listen into what Bev is saying. Honestly, when I was in Jamaica, living in Jamaica, I didn't know what mental health is. I didn't know anything like this. And it is only since I came here that it is more obvious and prominent that I can connect with, right? And so I'm happy for this information, Bev, that you're sharing. And I hope that you listeners, our viewers, can lean into this conversation. And when you take in all this, do something about it. And if you know someone out there that is struggling, that is having a problem with mental health, please help them to seek help. Yes, Kaydian.
Yes, it's so important for us to be non-judgmental.
Right.
To be very sincere in our help for persons who are struggling, because it's a real struggle.
Yes.
And today is them, tomorrow we might find ourselves in that situation.
Yes.
So, we have come to the end for this part of the discussion. Next week, we'll pick up on what healing looks like and practical ways we can use to navigate depression and anxiety. And you'll hear more from us, our own journey through depression and anxiety.
Yeah, we just want to thank Bev for having shed such bright light on this section of our discussion.
Thank you, Bev. We appreciate it.
And Simone, what do you have to say to our viewers?
Please join us next time on AdventistOntario.tv, Roku, and Amazon Fire.
And tune in every Sunday evening at 7 p.m.
And join us next week when we continue this discussion, this very important discussion on how we navigate depression and anxiety, particularly as Christians.
Thank you for joining us. This is Mantled for More.
And remember, the mantle marks you, but more transforms you. See you next time.